Hello, everyone. My name is Cindy Kneller, and today I'm going to be talking to you about implementing a new electronic health record system or EHR system, Oracle Cerner at Beacon Health System, the benefits that this vendor poses, and then we'll walk through what an implementation plan would look like if pursued. So for our agenda today, I'm going to start with discussing the mission and impact of implementing Oracle Cerner's EHR, followed by discussing some of the implementation planning elements such as stakeholders, responsibilities, timeline, cost, and budget. And then we'll close out with discussing the patient population and what success will look like. So we'll start here with our mission. One challenge that our patient population in South Bend, Indiana has is access to chronic disease prevention, diagnosis, and treatment. So as a result, our mission is to utilize the electronic health record system, Oracle Cerner, to increase chronic care prevention or management and provide increased access to diagnoses, treatments, and outcomes in the chronic care patient population. By implementing Oracle Cerner's EHR system, our hospital can utilize their interoperability products that share patient data elements such as demographics, care teams lists, active problems lists, patient risk factors, and many more elements as well. They can also utilize data analytics and predict models, track clinical, demographic, and socioeconomic patient population data, utilize machine learning and evidence-based logic capabilities, as well as surveillance tools, employ some customer relationship management tools, also apply remote patient monitoring devices, consumer portals, and then finally can utilize community care management via healthy care tools. So we're really looking at taking a multifaceted approach to deliver better chronic disease management and care. So Oracle Cerner really emphasizes the importance of that longitudinal record by aggregating data from different systems and running predictive models against that data to enable clinicians to access insights across a wide variety of key management functions, which ultimately helps to prevent, manage, and or treat chronic conditions throughout the patient population. All right, so next we're going to talk about impact. According to the CDC, chronic diseases are the leading cause of illness, disability, and death in the US. They are also the leading drivers of the nation's $4.1 trillion in annual healthcare costs. CDC states that chronic disease intervention can help to improve health outcomes and decrease healthcare expenses, as well as improve quality of life for those who can now better manage their chronic conditions, increase access to chronic disease interventions for the patient population in the area, and then finally provide more efficient and collaborative electronic workflows for clinicians and staff, which would ultimately help the hospital to boost their reputation and provide better care while decreasing costs. There are additional published examples of how Cerner has optimized chronic care interventions through their EHR at the link included at the bottom of this slide here, in case you would like to further research some of their client achievements. All right, next we'll be reviewing the key stakeholders who have standing in this implementation and their responsibilities. So first up here in the top left corner, we have the C-suite leadership and our board of directors. And really the goal here is to provide oversight and build and strategize the implementation plan and timeline. Moving to the right, we have the information technology and our health information technology department, which will improve technical resources and strategy and provide domain support during and after the implementation. Then we have clinical department heads, which include leaders from specialty areas, and they will provide clinical input for strategy and workflow design, as well as advocate, support, and communicate with the staff in their department throughout the implementation. Next, down here at the bottom left, we have change management and the operations department, who will provide communications around system changes, help to manage the operations and performance, and support staff during the transition through change management models. Then we have the sustainment department, who will provide training to the system post implementation, as well as provide maintenance support. Finally, in this slide on the bottom right, we have the governance board, which will encompass representation from various departments to provide sign-off for data strategy decisions. So things like how the data is stored, sharing data outbound, enrollment of patient programs, and many more decisions. On this next slide, we have a continuation of the stakeholders and responsibilities who should be involved in this implementation. So starting here at the top left, we have compliance, legal, or regulatory department who will provide oversight to the legal and regulatory requirements and work within other groups to ensure that these are being met in the EHR. Then to the right, we have the Change Control Board, which will have representation from various departments and will facilitate approvals or denials for any technical design changes that are proposed to the EHR design, such as workflow changes. Next, we have the Finance Department, who will provide financial and budgetary approvals, recommendations, and oversight. Then here at the bottom left, we have Oracle Cerner implementation representation, including implementation trainers, integration architects, sales, project managers, domain strategists, and adoption coaches who will serve various roles, but overall provide recommendations and support to the strategy and architecture of the EHR, as well as work with the health system on the implementation and any customization. Finally, here at the bottom, we have the patient population who could be, community leaders, Department of Health points of contact, volunteers, and others who could represent the patient population to help drive the strategy, goals, care outcomes, and measures and initiatives to best address the needs of the health system's population. All right, so next up here, we have the implementation step and the number of days it will take to complete the activity across this process. So these milestones will be completed across the stakeholders we just discussed throughout the implementation. So starting here on the left, we have creation of the implementation plan. And this would also pull in, the resources that would be required for an implementation team. This planning should take place over 60 days. Then we'll submit a request for information or a request for a proposal and perform contracting for 45 days, which will then lead us to preparing the infrastructure, design, system configuration, and workflow customization for 120 days. This is followed by testing for 60 days and then training for 30 days. So we'll end the timeline with data migration for 30 days, and then the go live event will occur for 30 days as well when the system's actually turned on. So we're looking at about a year roughly. Ongoing efforts that will need to occur during and after go live include evaluating the EHR performance, improving the system over time, providing sustainment support, and supplying ongoing communications throughout maintenance as well. So certainly important to think about some of the elements that will need to take place post-implementation. All right, next up we have cost and budget. So upon considering the responsibilities of each group of stakeholders, as well as the timeline, I was able to estimate the number of hours per week and number of weeks that each group would be necessary within the implementation. There should be further consideration, like I said, of maintenance costs and activities that will need to be set forth post-implementation as well. But for today, we'll just be reviewing the activities that will need to occur prior and during the go-live event. To find these estimated numbers, I sourced information across various sites that can be found in the reference slide at the end of our presentation today. Overall, I took those hours and numbers of weeks that are needed from each group and multiplied the total hours against the average hourly pay for each group and came up with the total expenditure across groups down here at the bottom right-hand side, which was $268,825.60 roughly. Let's keep in mind, though, we will also need to be cognizant of not only our internal expenditures needed, but also the cost that Oracle Cerner charges. On average, a health affairs study estimates that the typical multi-physician practice will spend about $162,000 to implement an EHR, but other studies estimate the cost of purchasing and installing an EHR ranges from about $15,000 to $70,000 per provider, which is a very great variance. The important factor here will be in engaging the finance department in some of those conversations for budgeting and contracting to get a concrete number from Oracle Cerner and better plan around these expenses, but this slide will serve as a starting point for our estimate here. All right, and then to help manage the costs, like I said, we'll certainly want to ensure finance is pulled in, but we'll also want to ensure leadership approvals are in place from an oversight perspective. With the large costs, the budget will need to be in place to ensure we're on track to what is planned and contracted. Additionally, activities that I would recommend would be working with the community to advocate for increased funding, which could be through grants or donors. Additionally, if costs are a major concern, we can partner with other like domains from health systems who would like to share the costs, and Cerner offers that through their Community Works product. Next, let's talk about our patient population. So, according to Beacon Health System's most current community health needs assessment that we ran, chronic disease was identified as the second ranked top need in the community, which includes patients from Elkhart, LaPorte, Marshall, and St. Joseph counties in Indiana. So, in these areas, healthcare access was the number one social determinant of health. By expanding our technical capabilities related to chronic disease management, Beacon Health System can increase the throughput of patients they see and increase the outreach and communication to the community. Also, by saving costs after implementing an efficient EHR like Oracle Cerner, Beacon can take those savings and reinvest them into underserved patients in the community. So, according to the Community Health Needs Assessment, key barriers to healthcare access in the community were transportation, costs, and healthcare navigation. Oracle Cerner can help by taking those saved costs and using the funds to increase funding for transportation programs to help low-income patients to afford their care and increase navigation through more efficient workflows and interoperability products. The interoperability products that Cerner offers will also allow data to be shared with external facilities so that providers as a whole can better treat the patient population, regardless of which facility they work at. And then finally, Beacon Health System's patient population is in need of better chronic care interventions. And all of these elements can help to improve those chronic care outcomes within our population. So finally, here we have defining success. For Beacon Health System, it is important to reconsider the elements we discussed on our earlier in our presentation when we are looking at the intended impacts and benefits to the patient population that implementing Cerner would pose. Overall, we're looking to improve chronic care outcomes, decrease healthcare expenses, improve quality of life, increase access, and streamline efficient workflows. However, to manage this, it will be important to define success or performance measures to ensure our objectives are being met. I recommend the following performance measures to ensure success not only in the internal operations, but also in the community. So these measures that I have listed out here on this slide can be utilized to inform next steps, key focus areas, and other initiatives when they're ran against the data. So they're here on the slide, and I'll also be sending out this presentation slide deck after our meeting today to ensure that you can take a look at this list. So overall, I believe the Oracle Cerner EHR implementation can help target a key need in the community, access to high quality care interventions, ultimately improving the health of our patients. We reviewed elements of the implementation plan that would need to be considered, such as stakeholders and responsibilities, timeline, cost and budget, and performance measures. But now I wanted to open it up to the group to see what questions you may have for me today. And if there are no questions, we can go ahead and close for today. I would like to thank all of you for your time, but please reach out if there are any other questions as we move forward. Thank you so much.